Welcome to TriHealth Live, and we happen to be here at the Thomas Center on the campus of Bethesda North Hospital. And in this beautiful new facility that opened earlier this year, we house many different specialties. The Heart Institute, the Cancer Institute, imaging, and we also have an infectious disease office here where we see patients. And so we're happy today to talk about infectious disease, especially as it relates to HIV and hepatitis C. And we have with us today two of our infectious disease physicians, and I'm going to let them introduce themselves. Dr. Patel, why don't you start?
Hi there. Hi, Mark. I'm Dr. Patel. I'm one of the infectious disease physicians here at TriHealth.
Hi, Mark. I'm Dr. Martin Nioni, one of the infectious disease docs here at TriHealth.
So this may be one of the first times in the last year we've had a conversation about infectious disease does not include COVID.
Right.
So we're going to talk about something else here today. And let's talk about HIV. And Dr. Patel, you treat patients who have HIV, and we see a lot of communication about the day. So why don't you give us a little update on where we are? I've noticed over the past year as well that there's been a lot of comparison between the beginning of the COVID pandemic to the information about HIV and what we were learning. So why don't you talk about prevalence and what you see as a practicing physician?
Sure, absolutely. So in the past couple years, in the prior government administration, they created the Ending the AIDS Epidemic program, which was really trying to identify new cases of HIV and reduce the number of people who had new diagnoses and also get those people who had a diagnosis into treatment.
Okay.
And so they identified 41 counties in the United States that had the highest rates of HIV in that county.
Wow.
And these were considered HIV hotspots, and in fact, Hamilton County was one of them.
Wow.
So you can kind of see on this map here of Ohio, all of the areas that are the bright red are areas that are considered to be counties that have a really high HIV prevalence, and you can see that Hamilton County is one of them.
And why would you say that is? Why do we see the higher prevalence here? Or any
So there's a couple reasons for that. One is you have to think about the population of the county and then also the risk factors for why people get HIV transmission.
Yeah.
And some of these major risk factors include men who have sex with men, anyone who is heterosexual but has a partner with unknown HIV status,
Yeah.
anyone who's had an STD diagnosed in the prior 6 months, and then also injection drug users or people who share drug preparation equipment.
Is HIV testing part of a normal panel for a patient in a primary care office?
That's a really good question. And in fact, the U.S. Preventive Services Task Force, which is kind of the governing body that identifies really important screeners.
So they
for
recommend
patients.
about mammography
Correct.
and colonoscopy.
Exactly.
And they really help drive from a public health perspective.
Absolutely. So they are driving from a public health perspective all these things that are really important to screen patients for, both for prevention but also for a cost benefit.
Yeah.
Looking at the system as a whole. And they've identified HIV testing to be part of that comprehensive care for a patient. Anyone who's sexually active, that includes anyone above the age of 13. And then that's at least once in their lifetime, but patients who may have more risk factors should be screened pretty regularly for HIV.
How do doctors talk to patients about risk factors? Is that one of the challenges, like the willingness to address risk factors, I guess?
It shouldn't be, because of course we want everyone to have a very trusting relationship with their doctor, where they can identify anything in their life that is concerning for them.
Yeah.
And so one of those things is identifying sexual interactions that the patient may be having, injection drug use, things like that. Those should be things that a doctor should be willing to discuss with their patient. And a patient should be really open to bringing up with their doctor.
So those kind of screening questions are life-saving measures.
Absolutely.
Really. Absolutely. So talk a little bit about some of the work that you've done, I know, in your work and your training regarding prevention and new developments in that. I think for some of us, we see this commercial called Descovy. And wonder about what it means. People ask questions about it, and they're direct to consumer marketing. But talk about prevention and what's possible.
Absolutely. So that's a really good question. So one of the newer amazing developments in the past 10 years is PrEP. So PrEP stands for pre-exposure prophylaxis, and I actually have a slide about PrEP too, about what it is. So it's an HIV prevention method that is used where someone can take a pill every single day to prevent acquisition of HIV through any risk factor that they have.
Wow.
And PrEP was, the first drug for PrEP was Truvada, and now there's another one, Descovy, that you mentioned, but both of those are equally effective in preventing HIV transmission. So it's one pill taken once a day in both men and women. It was approved for use in 2012, so we've been using it since then. And it's more than 96% effective in preventing HIV acquisition
Higher
for someone.
than any one of the COVID vaccines.
Slightly higher, but yes,
slightly
it is.
higher,
And it's really safe in patients
So we
too.
should have a lot of confidence. Patients should have confidence in it.
Absolutely.
Physicians should have confidence in prescribing it.
Absolutely. And there are monitoring parameters that the patients need to go through every 3 months where they do testing as recommended by their physician. And then they should also know that PrEP does not protect against other sexually transmitted infections. So they should continue to use other barrier protection, et cetera.
What about
when
its
they're using
adoption
PrEP.
rate since 2012?
So surprisingly, we aren't seeing as widespread use of PrEP as we would like. So there was a big study done, and it showed that almost more than 1 million Americans actually met eligibility criteria for PrEP.
Wow.
And would you guess the number of people who actually use PrEP?
I'm going to say 10%.
Yeah, I'm really bad at math, but maybe about that. So about
Yeah.
150,000.
15,
Yeah,
15%.
so those are the only numbers of people actually using PrEP right now. And so we really would like to increase our expansion use of PrEP so that we can continue to see a downward trend in the number of new HIV diagnoses.
And do you take it for a lifetime? Or?
So you take it as long as you're at risk.
Okay.
And that may be a lifetime for some folks.
Okay.
And that may be a shorter time frame, for other folks, depending on what that risk factor is.
So it goes back to this understanding of risk factors.
Correct.
Being clear about that. And then that's related to the decisions about going on to PrEP. and what that
Definitely.
means.
And those are continual conversations the
Wow.
provider will have with their patient.
Do you feel like primary care and patients are aware of it, or how could we help that awareness? Because it's so
Absolutely.
important.
Yeah, we want more providers and patients to know about PrEP. So that one, providers can bring it up with their patients who may be at risk.
Yeah.
That includes screening patients for those risk factors we mentioned. Anyone who gets STD testing should have a conversation about PrEP with their provider, or their provider should have that conversation with them.
Okay.
And a lot of times patients see those commercials you mentioned,
Yeah.
and they bring it up with their provider. Hey, I
Right.
saw this commercial. I feel like I might benefit from that.
Yes,
And
right.
so they, get referred to us, or they get treated by their primary care for
Okay.
it.
So if you have questions for Dr. Patel or Dr. Ignoni as we go along, put them in the chat box and we're going to ask those questions. How about anything else about HIV that you wanted to share, and we'll go on and then come back with some other questions. So.
No, I think you asked really good, great questions, and I know that there's some overlap with HIV and hepatitis C that I
Okay.
think Dr. Nioni is going to bring up
Yes,
as well.
actually, PrEP, what she's talking about, now is being offered to patients that use drugs, intravenous drugs, just to prevent HIV. Actually, we have some cases now close to the hospital with acute HIV infection due to IV drug use.
Okay.
So PrEP has been expanded to intravenous drug use as well.
Wow.
So that's why there is some overlap. I mean,
Okay.
it's not...
So explain to us, Dr. Ignoni, Hep C. We hear it called Hep C. Explain what it is, and let's talk about, because there's some new developments in the treatment of hepatitis C as well.
Okay, so I'm a board certified infectious disease in Argentina, and then I became certified in the United States. So I've treated Hep C since the 2000s.
Wow.
So we've seen like a revolution of hepatitis C treatment over the years, during the last 10 years. First of all, just to clarify, what is hepatitis C? This is a chronic viral inflammation of the infection and inflammation of the liver. It's caused by a virus called hepatitis C. How it's transmitted? That's what people mostly ask. The most common by far way of transmitting Hep C now is intravenous drug use. Probably you heard in the news about blood transfusion. That's no longer a problem. Tattoos, piercing, that's not the most common reason. And there is some sexual transmission in men who have sex with men, but by far, and mother-to-child transmission, but that's still not very common.
Yeah.
by far is intravenous drug use. So we had a huge problem with the opioid crisis.
Yeah.
What happens is that the news and they talk about the opioid crisis, but nobody talks about hepatitis C. And the people must know that if you don't treat hepatitis C within time, you can have many complications.
Yeah.
One of the complications is cirrhosis, liver cirrhosis and liver cancer. And the advantage that we have right now is the screening tests that we have are excellent. The confirmation tests are excellent. We can do it in 1 day in the clinic with just one screening test.
Yeah.
And the treatment is extremely effective and short. We can treat somebody in 8 weeks with pills.
Wow.
In the past, I used to give interferon once a week with fevers, feeling terrible, and pills every day, ribavirin. And it was terrible. 1 year of treatment, 1 year against 8 weeks or 12 weeks.
Wow.
So
let's talk about screening. How are people screened for it? Is this in a normal screening panel, Hep C?
Yes, it's very easy.
Okay.
Basically now everybody more than 18 years of age or less than 18, if they have risk factor, needs to be tested for Hep C.
Okay. So in my normal physical, where they draw a blood panel,
you should ask for a Hep C ELISA. That's it's like a screening test. And then you have the confirmation test.
Okay.
Maybe you have a positive screening test and it's a false positive, even though it's not common.
Yeah,
so it needs to be confirmed with a PCR.
Okay.
But we can do it in the clinic, in your PCP. It's very easy.
So we heard about PrEP. It's related to this. The new development in the treatment of Hep C. Explain that to us.
Well, like I said, there is a revolution in the Hep C treatment.
Yeah.
We went from 6 months or 1 month in the past, in the 2000s, to 8 weeks now in 2021. And there are mainly two combinations of viral medication that we use. Okay, and one is usually 8 weeks, and the second is 12 weeks.
Yeah. Okay.
So it's very easy to take. The medications don't have adverse effects. No. Basically, maybe I had one that had some nausea, but in 8 weeks you're done.
Amazing.
It's amazing.
So what about prevalence? What do we know about the prevalence?
We have a huge spike in the cases that is related to the opioid epidemics. Opioid crisis, and especially in rural areas of the United States.
Interesting.
So we see a lot of patients in the clinic, a lot of patients in the hospital that are admitted with infections that we discovered that they have hepatitis C.
Okay.
And we see this every single day.
All right. So we have a number of questions. How about if we kind of go through some of the, first of all, anything else about Hep C that you wanted to share? Because we have some questions for you from...
I cannot emphasize more that everybody needs to be tested.
Okay. All right. What happens in pregnancy in either Hep C or HIV?
Well, a lot of patients that use drugs, they become pregnant.
Yeah.
Ideally, we need to treat these patients before they become pregnant. Once they become pregnant, that's a problem. Why? Because we don't have too much data. There are only 2 clinical trials of a medication that is called Harvoni, everybody knows, that they had 100% response rate, but still we don't know exactly the long-term effects.
Yeah, sure.
So the guidelines recommend a discussion with the provider to treat it during pregnancy. But ideally, we would prefer to treat before pregnancy, and there can be some transmission to babies, so that's why it's a problem.
Okay, Dr. Patel, about HIV and pregnancy, what can we say?
So it is really important to make sure we identify HIV infections either before or during pregnancy. And actually, HIV screening is a routine part of prenatal testing.
Okay.
So in fact, we do see a lot of referrals for patients who've had a positive HIV test, and that is their first diagnosis when they also learn they're pregnant. And that's a big change for the patient.
Okay.
They're pregnant and they learn they have HIV. We have very good medications to treat HIV in pregnancy. Okay. And they are both safe for the mom and safe for the baby.
So they deliver babies?
Absolutely. We deliver lots of healthy HIV-negative babies in patients who have HIV who are on treatment.
Okay.
Now it's recommended also to test in pregnancy, every pregnancy, for hepatitis C. And of course, they will test for hepatitis B as well.
So, an interesting question. If somebody seeks not to get treatment, what happens? What, and maybe it's a question about barriers to why people don't get treated and what happens as a result of that. You want to start, Dr. Patel?
Absolutely.
We'll
so, you may be surprised to know that 1 out of 8 people who has HIV infection doesn't even know they have the infection.
Wow.
So that's the big thing, is actually making sure we're doing universal screening so that everyone who has the infection knows they have it, so that they can get into care and get started on treatment early. Because this treatment is so effective for these patients, it can help prolong their life. Without treatment, the virus, the HIV virus, will continue to deteriorate their immune system and leading to other opportunistic infections and complications.
Wow, the importance of the honesty with your physician is key.
Absolutely.
Right from the beginning. How about Hep C and non-treatment or barriers?
Well, the problem in the past is that all of these patients, they were told that they didn't have enough disease in the liver, so the disease was not advanced enough. So at some point they were told, okay, you have to stop using drugs, we have to wait until you are clean to treat you. And these patients would get lost for years. And then they show up at some point, and that's when they have advanced liver disease. So what happened now is they saw that we need to treat everybody, and everybody gets treated. Actually, there are multiple clinical trials here and in Europe that you can treat people that are using drugs. Of course, we don't encourage to use drugs, but still, these patients, since they take 1 tablet a day, for example, they still can achieve cure with hepatitis C, even if they use drugs.
Wow.
And all these patients that were left behind in the past, now they can get to the system and get treated in 8 to 12 weeks.
Great. So here's an interesting question. You kind of talked about it a little bit, but I think it's an important one. If I see a commercial on TV for a treatment, how do I bring it up? How do I approach that topic, which can be a little uncomfortable, right, in terms of what we've discussed here? We've talked about, sexual activity, IV drug use, so forth. What do you recommend? How do you give advice about how do you bring it up?
We had again talked about, how important it is to have a good relationship with your physician. And that's where that trust comes into play. If you feel like, and this can go for HIV medications, hepatitis C medications, or any other treatment that you see on TV, the best source of information for that is going to be your physician. And
How about to somebody else? How do I bring it up with my partner, for example? Do you have any recommendations on that?
I mean, this is a question that gets brought up when we see patients who have new diagnoses. How do I tell my family members? How do I tell my friends? How do I tell my partner? And it's important because a lot of times your partner needs to know that you have this infection because they're at risk. And so we definitely have this conversation, and it'll be an individual kind of approach for every single person.
Regarding hepatitis C, this time, a lot of people don't like commercials, but really the commercials of hepatitis C treatment, they really reflect what you see in the real life. 97%, 98% of the patients get cured, and thanks to the commercials, a lot of people seek to be screened for hepatitis C. So I'm completely on for the commercials, and I think we have to be really thankful to the drug companies because this revolution is also, it's because of the drug companies that developed and invested so many millions of dollars in research. Otherwise, we'll be still giving the shots for 1 year.
Right, great. What else? Anything else that you want to share? Why?
I mean, I think Dr. Neone mentioned this too, but screening for both of these diseases is so imperative. Screening for both HIV and hepatitis C. Everyone should be screened. You should absolutely know your status in regards to both of these because it's so important for early diagnosis and getting into treatment because, again, they're so manageable and with hepatitis C, even curable.
So just while we're on that topic, side effects of treatment, you said earlier is minimal?
Almost none.
So it's not,
Just,
that's the amazing part about it is that the side effects are minimal
exactly.
as well, right?
So the only thing we have to check drug-drug interactions between your medications and the Hep C medications.
Okay.
And usually, with the HIV medications to check the interactions. But other than that, the medications, again, I never get a phone call from patients, very rarely, to complain about adverse effects. And 8 weeks and they are done.
Anything else, Dr. Neone, you wanted to share?
Just, if you have questions or anything, just call the clinic. We have an enormous staff waiting for your phone call and to schedule your appointment. We can see you the same week if you call.
Absolutely, that's super important. Patients should know if they want to seek care with us for hepatitis C, HIV, or to get PrEP,
Yeah.
They should definitely talk to their primary care provider or call our clinic to figure out the best way to come in and see us, because we're very available to see them.
Yeah, so the important role of infectious disease in the community here is a key one. We have another question that came out. This is an important question. Many drug users don't trust doctors, right? I mean, this is part of the whole issue right now about people refusing even the COVID vaccine. How do we move to trust? How do we get people to, what suggestions can we have? And that may be a question like, how do I advise my friend or family member? How do you deal with these questions of trust?
Well, I have a good feedback with all my patients,
Yeah.
and the best, because I treated a lot of patients with Hep C in Kentucky. It was a difficult area. But the best way is to put yourself in your patient's shoes,
Yeah.
and they will automatically trust you
Yeah.
because they know that you are at the same level. You are not less or more. You just put in your patient's shoes,
Yeah.
and they will completely trust you
Yeah.
because they know that you care about it.
Yeah. And it's an important message for us to share with their loved ones, their family members. How can I get to a level of trust? Is that
Exactly.
what's available?
That's
Dr.
important.
Patel, anything about trust? This is a
Yeah.
really important question.
Super
I think.
important. And
Yeah.
like you said, not just for the things we're talking about here, for the COVID vaccine, et cetera.
Yeah.
It's just really important to know that your physician really has your best interest at heart.
Yeah.
They want you to get better.
Yeah.
And so kind of our recommendations and our conversations that we have with our patients
Yeah.
are really along the lines of, these are the things we know based on science and research. And that's what we know in terms of the things that will make you better, will make your body better with regards to these diseases.
So I think one of the important things that you've brought up here today is that your clinics in infectious disease, and I'm just going to say it this way, it's a no judgment zone.
Oh, yeah.
Absolutely.
Definitely.
This is not about judging you whether or not
Correct.
you've had whatever sexual encounter or IV drug. It's about healing people
No
and really
judgment.
dealing with it. So
Absolutely.
that's an important message, is that
Very
you're
important.
here to treat people, whatever their disease is, and however we can. And that's why these medications have been developed, that are amazing developments.
And my message is, I look forward, not backwards. Okay, so
Good
we just
point.
look forward.
Yeah, great.
Yeah, there is a lot of stigma associated
yeah.
with these diseases, HIV, Hep C, seeking out treatment for even HIV prevention.
Yeah.
And
exactly.
we really need to make sure that people know that there is no stigma in the healthcare, or there shouldn't be,
Yeah,
right.
from their providers.
Right.
Like, it is no judgment zone, like you mentioned.
Yeah.
But there is stigma in the community, and we're constantly working to break those down.
And protecting the privacy of people, that's part of it.
Absolutely.
You're protecting their privacy,
Always.
and it's not, as part of this treatment, that's a key component. Right?
But a lot of these patients that use drugs, some of them in jail, they have to go back to the family to get some help.
Yeah.
So I try to approach all the family together, not only the patient.
Yeah.
So we always see families also in the clinic.
Yeah, it's
talk
an
about it.
interesting point, right? Is that really
Family.
the kind of ecosystem of care and how we deal with families and the dynamics are part of that as well, right? Those are pieces you have to negotiate
yeah.
in the treatment of patients.
Definitely.
Right. Wow, this has really been interesting, and as you can see from Dr. Patel and Dr. Ignoni, their commitment to the development of care and their concern for their patients. And another example here at TriHealth of the great work that is going on by our clinicians as we seek to bring healing to our community. So we appreciate your time here, and if you have any questions, you can go onto our website, trihealth.com. You can also look up Dr. Patel and Dr. Ignoni and also call our offices to make an appointment if you have a question. And we really appreciate your time today. Thank you, doctors.
Thank you,
Thank
Mark.
you, Mark.
Great conversation we had today as we continue to try and spread information about the treatment of disease. So thank you all, and have a great day.